The video that we chose to watch was Taboo Changing Sex. This video was about transgender people, and it showed case studies of transgender people who had undergone sex changes. The people in the video, German athlete Balian and transgender couple Ashley and Tony, underwent successful gender reassignment surgery. While the people in the video all seemed to have successful experiences in changing sex, we were curious about how often there were complications in sex changes. The successes in the video led us to the question, is a sex change operation more likely to be completely successful or result in complications?
For the purpose of this experiment, we define a successful sex change operation to mean that the patient is happy with the results of their operation and that their new genitals are fully functioning. We define complications in a sex change operation as meaning that there are secondary medical conditions that occur as a result of the operation.
The hypothesis for our experiment is that there are more often complications than completely successful sex change operations. Our null hypothesis is that more sex change operations are completely successful than not.
Our experiment would include an observational study in which we would observe the results of sex change operations. Some of the methods of observation would be to talk to patients to see if they are happy with the operation and if the new genitals are fully functional. Another method would be to observe and note any medical complications that arise as a result of the operation.
We expect that after making observations about the results of sex change operations, that there will be a higher incidence of complications than of completely successful operations.
After researching the outcomes of sex change operations, we are rejecting our hypothesis. We found that while there are often complications in sex change operations, there are more successful operations than there are operations with significant complications. Some of the common complications that can occur with sex change operations are major infection or bleeding, damaged bladder, damaged prostate, and damaged neurons. More severe complications that can occur with male or female sex change are partial vaginal prolapse, prolapsed labia majora, which requires removal of the glands, urinary dysfunction, and more severely, rectovaginal fistula.
After discovering rectovaginal fistula, we decided that we wanted to investigate it further. According to the Mayo Clinic, a rectovaginal fistula is an abnormal connection between the lower portion of your large intestine, your rectum, and your vagina. Contents of your bowel can leak through the fistula, meaning that you might pass gas or stool through your vagina. A rectovaginal fistula may result from an injury during childbirth, Crohn's disease, or other inflammatory bowel disease, radiation treatment, or cancer in the pelvic area, or a complication following surgery in the pelvic area. The symptoms of rectovaginal fistula often cause emotional distress as well as physical discomfort, which can impact self-esteem and intimate relationships.
But it's a very complicated surgery, and so with that comes a lot of variability in factors, things that can happen. You could also get infection. You could get major bleeding. You could end up with a blood transfusion. The most major complications you could have would be like a fistula formation of either the bladder or the rectum. All surgeons have had those, and which would mean that you would poop through the vagina potentially. Horrible, not good, not something you want to have. So, and you have to just, it's just part of that's what you're getting into.